Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society. And I have something here, again, the truth and not the truth. And I'm going to show something that is the truth. The pain along with the retention, if the person leaves this, if you got a deep bite case, and they leave their retainer out, maybe they left it at grandmother's, and they get it in a couple of weeks or sometimes even less time than that, and they put the retainer back in, and it begins to hurt. And so it gives them trouble, and they think the retainer has warped or something is gone goofy with it, and so they come in with pain when they're wearing a retainer. And it's just a natural thing. You put the retainer in and your teeth start hurting. You take the retainer out and it stops. So you would naturally think there's something wrong with this retainer. And this has happened to me, and it fooled me for a case or two like that, and I couldn't find anything wrong with the retainer. And I got to thinking about it, and it finally dawned on me what was taking place. In other words, this person we're going to show here did not bring his retainer back. This is the deepest bite I think I've ever had, where you don't even see the permanent teeth on the bottom with it. And then if he left it out for just a week, I would think he'd put it back in and it would just touch on the bite plate and the condyles back here. So let's take a look at this and we'll see what's taking place here. Okay. Now, here was the guy's teeth when we started out. Now I've got a whole host of pictures of how we got here, if you ought to go back and study the whole thing. But I'm showing you what happened in here. These teeth right here, and you can't even see these bottom teeth out across here. You can see a little bit of that cuspid and this cuspid over here, but you can't see it. In other words, the bottom teeth were way up here in the roof of the guy's mouth. Now he is a airline, what do you call them, directs the planes into the airfield and everything. And he has to be heard. And so we started with a big retainer back in the back, and it didn't work. We had to put one, just a little bitty one, on the front teeth, and it did work, and we had the other teeth come together. Anyway, we worked on him, and we got this to this point right here. I don't have the date on those two pictures right here, but his upper teeth closed completely over his lower teeth. I mean, I have to get it down here to see that. And you can see this full length of these teeth across here was completely covered up, except for one spot on the lateral, I think, on the right side over there. And so we had to open the bite here. And you can open anybody's bite that's living. And I don't care what you think about adult teeth not moving or not, the bone not going. These teeth did not get to be shorter in any way. As we put the intruding wires in, the whole section of the teeth, bone, teeth, and all moved up here, and also it was going down in this area right here. And that will do that if you put a bite plate in there and let that bite on that, and this will this will open the bite, and I have not found an adult that I couldn't open the bite, or that's the kids or adults or anybody else. And so I'm going to stand on that fact that adults and anybody in there, you can intrude their teeth, but you intrude the whole jaw. These teeth are just as long as these over here. You'd think this would just shove the tooth in the bone. The bone around the teeth moves up with the teeth. And that's another fact. And that you can write that one down too. When you move a group of teeth, the bone with the teeth goes up at the same time. These teeth down here are no longer or no shorter than any teeth. I mean, if you could see them over here. Now let's go and look at another picture I've got. Now this is, when we got through it, he was missing a tooth on the bottom, I think it would be the bottom left side. And we had made a retainer down there to hold that space open till he could get an implant or something put in there. This is the upper retainer, and he has a bite plate on that retainer. And right here, this made. I think we'll show this in his mouth. Now this is in the mouth, and we put a bite plate right in here. When he bites, his lower teeth goes into that groove right there. And if he wears this thing, his bite will not deepen dentally anymore. But it may go down, but it'll go down in that same order. Those upper teeth will go, and if it lowers down again, it'll go down in that order, like that. Now, a person, just anybody, now he wanted to keep this bite open because he can speak good now. He's an air traffic controller, and he really needs to speak correctly. And so he can do that now. And so he pays attention to wearing his retainer and everything like that. And I've not seen him now in several years, but I'm sure his bite is still open there. He's not got this deep bite anymore. And so when somebody would come in and they had a deep bite and you made a retainer, and they'd go to grandmother's or maybe forget their retainer somewhere, and for a week or two they didn't wear the retainer, and they'd take it and put it in their mouth, and they wouldn't be very long till their jaw would be bothering them. And so they take it out, and the pain goes away, and so they just naturally think the retainer is the cause of this problem right here. And so people would come in like that, and I would go and get the model that I had I made the retainer on. I still had the model. And I said, "Can I see your retainer?" They said, yes, they had your retainer. You put it on that model, it fits like a glove. That retainer had not moved one bit. And now, when I put it in, the person's jaw begins to hurt. And it took a case or two for me to finally dawn what was happening. The people bite was real deep, and you leave your retainer out for just a short time, and I will guarantee you it will go to close back down a small amount, maybe just 2 millimeters or so. But now you put the retainer in, and none of these teeth in the back touch. And that's where the pressure should be distributed over these teeth. But now the pressure's on the front teeth and the condyle. The condyle's moved out of the deal here. In other words, the teeth Just open the bite, and now the pressure's on the condyle and the front teeth. And then you go pressing on that retrodiscal tissue, and it'll begin to hurt or bother them. You take it out, and now your teeth will go together, and it hits on the teeth themselves. The bite deepens some more, and that makes the teeth, they take the blow, and that doesn't hurt. So they say this retainer has moved, but it's not the retainer. It's the person will have to put this retainer in and wear it some. If it doesn't hurt too much, in just a few days, it will go back to where it was. If it's a pretty bad case, you have to come back here at the back of the mouth and put a pad on, and then you bite into the retainer, and you bite on this pad. Now that takes the load there, and the other teeth will move together again. And when you get them biting there, you take the pad off, and it will be back working like it did to start with. Now, this will fool you. You'll think, this person puts a retainer in, it hurts. Take it out, it doesn't hurt. And you think, well, just plain sense tell you that something's wrong with this thing you're sticking in your mouth. Well, the thing is, your teeth changed. The retainer did not change. Let me see if we got anything else. Here is the lower arch where they put this saddle down here, and I had to wear that until they put an implant, or it would be better to put an implant rather than bridge in there. And I think that's what he got. And he probably didn't have to wear the lower retainer if he had that. Now show that. And this is a fact. People will come to you and they think the retainer is wrong. Keep the models that you made the retainer on, and just take the retainer, put it on there. If it fits like a T, like a glove or a thing, then it's not the retainer. It's the bite has deepened, and that puts the pressure on these teeth and on the condyles right here at the back. So thank you for watching, but that's the thing that fooled me for a case or two till I figured out what was going wrong. So I thank you now for watching, and you can write this one down, and that is the truth as far as I can tell